Hello, Ben.
Morning, man.
Thank you for coming in.
Thank you.
It's a pleasure to see you today. How was the drive over?
That was good.
Okay, good. So, where we need to start before we start our session, I need to let you be aware of a few things before we start. I'm a graduate student in the master's degree program, working towards my professional counseling degree. I am currently practicing counseling techniques and therefore will be recording our session, but only for the professor and my classmates. The recording will be destroyed at the end of the semester. Likewise, you should know there are some limitations to my counseling. Please note that it is not possible to guarantee any specific outcome regarding your counseling goals. However, together we will work together to make sure we get the best outcome possible for you. Okay. So these are your rights. You have a right to inquire about the process and procedures being used at any time during any session. Okay. Once you have begun counseling with me, you're under no obligation to continue. You have the right to discontinue at any time. Uh, Even though if you do that, I will ask you to participate in a termination session before you change counselors or move to another counseling center. Should you deserve a referral to another counselor, then I will provide you with that as well. My services are will always be rendered in a professional manner with ethical standards of the American Counseling Association. If you have a complaint concerning malpractice, this can be reported to my supervisor at this time, which is Mrs. Hannah Marsh at Counseling Connections for you in Pearland, Texas. You are also aware that this session is going to be recorded. Are you okay with that?
Yes, I am.
Okay, the recording is for the benefit of my evaluation. And if recorded, you will only be viewed, as we stated, you will only be viewed by the instructor and the classmates. This recording will be destroyed after the completion of this course. Okay? I will get you to sign this document that I just explained to you, and it'll just become a part of your permanent file. If you don't mind signing that for me, please. Thank you, Ben. Since we didn't get a chance to complete that before, thank you for allowing me to go over those particulars with you today. You've already filled out your assessment form, and I thank you for that. You indicated that you've never been treated by a psychiatrist
Correct.
and you've never been hospitalized for mental or chemical dependency,
Right.
uh, and you have not seen another therapist in the past 24 months. Is that correct?
Correct.
Okay, okay. Have you ever attempted suicide or thought about, contemplated, or made a plan to commit suicide?
No.
Okay. Uh, as what brought you here, you briefly described as anxiety over your wife's medical condition. Is that true?
Yes.
Anxiety disorders are common, so we'll be glad to talk through that. And you haven't tried anything else for handling this situation?
No.
No? Okay. I noted on your paper you said just praying about it.
Yes.
I think that's always beneficial. It looks like you have a very close family relationship. You have a circle of friends and pretty well rounded life from what I see. So the only thing that's brought you here today is the anxiety over your wife's medical condition.
Mm-hmm.
Okay. All right. So let us get started. I'm gonna ask you some questions for this intake session. One other thing I forgot to mention to you is a privacy and confidentiality statement. Is that anything you share with me here in this session, it will be held in confidence. What you and I speak about will never be divulged unless I hear that you plan to harm yourself, if you plan to harm others, if there's any indication of elder abuse or child abuse, or if subpoenaed by a court. That is the only way that anything you and I say here will be divulged. Okay?
Okay.
All right. So, we've already covered that part that your wife's condition, medical diagnosis brought you here today. Can you tell me how you've been feeling lately?
I've been feeling really anxious lately.
Okay, okay. And how long has this been going on?
It's been going on for about 6 months or so.
Okay, so I hear you say you're anxious. It's been going on for about 6 months. When those anxious times come up, how do they affect you? How do you feel?
Get a rapid heartbeat. Um, my breathing gets a little rapid. Also, I start sweating.
Mm-hmm.
Sometimes I feel nauseous and sick, and I haven't been sleeping very well lately.
Oh, I hate to hear that, Ben. I really hate to hear that. Um, so, what was going on in your life? Was there anything going on in your life before your wife was diagnosed to make you feel anxious?
No.
So these are totally new symptoms.
Yes.
Okay. Have you talked to your wife about her illness and the anxiety that it's causing you?
No, I haven't because she's handling too much as it is already. So I don't want to burden her on with my problems as well.
Okay. I hear you want to be strong and that you don't want to burden her, but sharing with your wife doesn't diminish your strength in any way. Do you think she would be critical or understanding?
I believe she would be understanding, but I don't feel like I should tell her about these anxiety attacks.
Hmm.
She would be trying to make sure I'm okay, and she wouldn't focus on her own health.
Okay. Sounds like your wife is understanding. And I think it would not take the focus from her, and that she may want to know how her diagnosis is affecting you and your health.
Yeah, it's meant she's real understanding, and she would be concerned for me and my mental status as well.
Okay, I want you to know that what you're dealing with is not uncommon, especially when your loved ones are suffering, going through a chronic illness. Uh, and I hear you say that you don't want to burden her, but I think maybe talking about it would help you get through the anxiety.
That's good to hear because every time there's a new symptom or a new medicine is introduced, or she gets a new side effect, it bothers me, and I can't control a panic attack coming on, and I try and hide this from my wife.
Okay. So I hear the diagnosis can change things in your life. Uh, I want you to know that it's normal, it's common, but we find that the more we talk about it, the more that we can release it and feel better. But I hear what you're saying about life changes, and it will increase the anxiety about what the future holds.
Uh, I hear you, but I'm the type of person who tries to keep a routine, and I don't
Hmm.
like to go through too many changes.
Okay, I understand that. I understand people who are used to routine. Changes can be a little daunting, but usually the fear of change outweighs the actual change itself. And I think this is something that would be easier for you if you would just consider either talking to your wife or find someone that you can talk about it with. Do you think you can do that?
I can try, but I won't make any promises. I don't really want to add anything else to her plate because she's dealing with a lot already.
That's really considerate of you to think that. Is there anybody else, a friend or family member, that you would feel comfortable talking to?
Um, yeah, I guess I could talk to parents, my brothers, somebody along those lines.
Okay, okay. I'm happy to hear that you will consider, if not talking to your wife, then talking to some family members about the anxiety that her illness is causing you. And I think you'll find some comfort in that.
Yeah, she's pretty understanding. I think she would want to know as well.
Yeah, I think she would want to know too. I hear what you're saying that she is understanding, and she would probably be able to handle her illness just the same, and also want to make sure that you're okay. The last thing most people want when they're sick is to burden others. So I'm quite sure that she would want to hear about what's going on with you. But like you say, if you can't share it with her just yet, then I think you should try sharing it with family members, your brothers, or something like that. So, what we need to do is talk about coping skills. Are you willing to maybe go through some skills that will help you once you feel your anxiety attacks or panic attacks coming on? Would you be willing to try it?
Yes, I'm willing. I'm
Okay,
open to it.
okay, that's good. So I see on your form you put that you exercise. You like to exercise a lot, right? Well, I think continuing that, exercising releases the endorphins that makes us feel better. So I would say continue your exercise routine because that's one of the coping skills for dealing with anxiety. How often do you go to the gym or work out?
Three, 4 or 5 times a week. Just
Okay,
depends.
okay. So when you work out, is that do you find that a way to release your anxiety or to make you feel good for a period of time?
It does.
Okay, good. That's good to hear because, like I said, exercise is one of the ways that definitely helps reduce anxiety. Another thing that we do is practice taking deep breaths when we feel the anxiety coming on, and some people will say inhale, count to four, let it out slowly to the same count. Some people say to 10, breath in, hold it in, and then breathe it out. I would say whatever you want to do, whatever number is good for you, 4, 8, 10, to breathe in, hold it, and let it out. If you try that when you feel the anxiety coming on, and probably in sets of three, sometimes that will help you center and get back to and relieve that anxiety. Have you ever tried the deep breathing exercises before?
I have it.
Okay. Were you willing to try them?
Yes, I will.
Okay, sounds good. And another thing is just taking a time out. When you're feeling overwhelmed, it's just to get away. It's almost like a kid putting them in time out, giving them some time away from the issue to calm down. So when you're hearing things about your wife's medical conditions, medicines, routines, whatever is changing in life, just take some time and give yourself a time out, regroup, maybe even do some deep breaths during that time, and come back and be ready to deal with what's going on. And you can also make sure you get enough sleep. Stick to a nutritious diet and limit your alcohol and caffeine intake during times where your anxiety is high because caffeine can trigger panic attacks and alcohol can aggravate your anxiety. So think about healthy diet, staying away from caffeine, staying away from alcohol, the deep breaths. And another thing you're going to have to do is just get to a point where you can adapt and accept this new routine that you guys may have in life. Do you think that's something you could do?
Yeah, yes.
How would you go about it if I just asked you that off the top? How would you go about adapting to the new routine?
Um, that's a tough one. Like you said, I'd have to try and apply some of the coping skills that you just mentioned,
Hmm.
and try to make those a routine in my life. Make this a new routine in my life.
Right, right. And so, since you say you're a routine person, maybe getting into the medicines or the therapies or the doctor's appointments, just making them a part of the new routine instead of resisting them, and that may be another way to lower your anxiety. If you know everything that's going on, and not step back and just be on the outside, it may be better to adapt to what's going on. Okay. Well, I am happy that you are willing to employ some of these. coping skills and to continue with your exercise and to hopefully get to the point where you can talk to your wife about it, and we will work on these things in the next, in the next sessions that we will have together. So we'll schedule your next appointment for 2 weeks.
That's fine.
That's fine. 2 weeks is fine with you. And I would like to thank you for taking the time to come in and taking a first step towards your mental health.
All right. Thank you as well.
Thank you, Ben.